Hey, everybody, it's Congressman Jamie Raskin calling out to all my friends in Maryland's beautiful 8th Congressional District and our friends across Maryland, across the country. It's Friday, March 15th. We're in Women's History Month. This is my favorite time of the week, Local Hero, and we get to recognize the people who are making the 8th District such an extraordinary place to live and work and to be. And my local hero is Becca O'Connor. You may have met her just last week when I brought her as my guest to the State of the Union address with President Biden. And Becca is a national leader for reproductive freedom and health. She's a mom herself to two IVF daughters who go to Silver Spring International Middle School, which was a pathway that one of our kids did. She works at the Center for Policy and Leadership at the American Society for Reproductive Medicine, which is their think tank and part of their advocacy nerve center. So Beck has been integrally involved in the struggle to make IVF and reproductive healthcare and medicine available to all of our people, not just in Maryland, but across the country. You're a local hero, Becca, and thank you for being with us.
Well, coming from my hero, thank you. It's an honor to be with you and an honor to do this work.
Say a word, if you would, about your experience at the State of the Union address. I brought you, of course, because we are in this crisis struggle now over reproductive health and medicine, IVF, abortion rights, and so on. What did you think about President Biden's speech, and particularly his somewhat edgy confrontation with the members of the Supreme Court who were there about what they had done in the Dobbs decision?
First of all, thank you again for the opportunity to be there. The platform was, first of all, as a person, of course, I was awestruck by the opportunity to be in the room and be present when the United States president said for the first time in his State of the Union address that we need to protect IVF. And as you said, took on these issues in a very direct way and head on, facing the Supreme Court that just pulled rights out from under Americans for the first time in 50 years that we've enjoyed in terms of abortion access and reproductive choice. It was a moment that has been years in the making, as we've seen this momentum toward anti-choice legislation and policy sort of edge its way into the conversation. But to know that there are folks like you and the president and others who are willing to stand up and say, we have to do everything that we can to protect access to these services, and to recognize that this is a we problem, that it's not just some folks, but all Americans who will benefit from having access to this reproductive health care. You can't really put a price tag on that. That was amazing. And I was grateful for the conversations that I was able to have, both with your fellow members of Congress and senators, but also with the many other advocates who were invited that I was honored to share the space with, and who shared their stories as providers and patients themselves.
Yeah. So tell everybody how you got into this, about Elise and Charlie, your daughters, your personal experience, and then how that led to your professional work here.
Sure. So I've been an advocate for my entire career. I'm a lawyer by training and have always been that person that wants to change the world for good. And when I was in the midst of doing my day-to-day work, I realized that it had been years that my husband and I had been trying to start a family and were not having success. And I went to see a reproductive endocrinologist, the fertility specialist, with my husband, and we were diagnosed with infertility. It was eye-opening. I think there are far too few people that recognize that this is something that happens to so many, and there's treatment and hope for those that are struggling to build their families, whether it's for social reasons or medical reasons or what have you. And so I was fortunate enough to be able to access care. And in that sense, I'm privileged because it was readily available to me. It was within my neighborhood at the time. And in going through the treatment, I also went through what so many people who go through this experience, which are the emotional highs and lows. It's a very challenging course of treatment when you're going through this and you have many questions about if, when, and how you're actually going to have the family that you're hoping for. And I was very grateful for the experience that I had from start to stop with the physicians, the nurses, the embryologists, the genetic counselors, the people that just held our hands along the way and explained to us every step of the process, and also helped us grapple with the exorbitant costs that's a barrier for so many people. You know, my insurance didn't cover this. My husband's insurance didn't cover this. But for, you know, fortune and having support from family, we wouldn't be where we are today as parents to Elise and Charlie. And I'm very cognizant of the fact that that is a privileged stance. And so when the opportunity came to take on a government affairs position with the American Society for Reproductive Medicine, which is an organization that represents the docs, the nurses, the folks that make IVF and ART happen, I leapt at it because I wanted to be able to give people the same opportunity that I had had and help pass laws that make it easier and more affordable to access care.
That's awesome. One of the things that I learned just from hanging out with you on the State of the Union Address Day and meeting a bunch of other people in the field is that the general public is just kind of coming into cognizance of all of this going on, and that this is actually a pretty big community of people. Something like 2 or 2.5% of babies born these days are by IVF. But there's been traditionally a lot of stigma associated to it or with it and with infertility generally. And I would just wonder if you would say a word about the changes that our country's going through around that.
Absolutely. I think, you know, with any such issue where it's a personal matter, family building, and there's also sort of a cultural expectation within certain facets of society that people are expected to be fertile and be able to produce a child and not have these struggles. And I think the more and more that we talk about this and connect the dots between fertility treatment and infertility care, with other forms of reproductive health care, recognizing there's a spectrum here. The more we do that and lift the veil, the more free people feel to share their stories. And that informs both the science and the medicine and the care that they're receiving. And so I have personally, you know, when I started my journey back in 2011, I was open about this because that's just my nature, but I am very aware that, you know, for many people, you don't say I'm going through IVF, or you don't necessarily advertise what that doctor's appointment on your calendar is. And in part, that's because there's no guarantee of success, although the science has come a long way. The truth is sometimes it takes several tries, sometimes it's unsuccessful. And people are guarded about that, understandably. But as more and more people come forward, and particularly in the wake of what we've seen in the past several weeks alone, and sort of raise their hands and say, I too have experienced this struggle, I too have gone through treatment. We're really starting to destigmatize it and also educate people on the very basics of how this process works and why it's important.
Yeah, that's so awesome. Well, you're doing so much to teach people about what IVF is and how it works, and to advocate strongly, even as there are these political headwinds in different parts of the country. Say something finally just about the American Society for Reproductive Medicine. I know that your offices happen to be in DC and in Alabama, where now there's this big decision defining an embryo as a human being, and so IVF as, in a lot of cases, murder, and that has created such a political firestorm across the country. But what kind of work is the American Society doing at the federal and at the state level?
Absolutely. Well, first of all, I want to thank you for being a champion for these issues on the federal level as a co-sponsor of legislation that we're supporting to create access to family building, that's sponsored by Congresswoman Wild and Senators Duckworth and Murray. We are, you know, it's all hands on deck. We're a small but mighty team here, and we're supported by our members across the country. We have more than 8,000 members who are doctors and other medical professionals, and lawyers and others who are very invested in helping people build their families. And so, you know, it's a full-on approach where we're also tracking state legislation in all 50 states and chiming in and weighing in and sharing views as necessary to make sure that we're informing the national dialogue on this and creating bills that mandate insurance coverage, that talk about fertility preservation and why people who may have iatrogenic or treatment driven from cancer, chemotherapy, infertility deserve and need to have coverage for things like preserving their genetic materials for future reproduction. And so we do a ton of that. We also have an annual meeting where we bring leaders from across the field together every year to talk about the latest science, to share ideas and research. And we're doing everything we can to just generally educate people and demystify what it is when we say art. It's a big term that when you boil it down means we're helping people fulfill their family building dreams. That's it.
Well, thank you so much for what you do, and thank you to the American Society for Reproductive Medicine. This is Rebecca O'Connor, and she's the director of the Center for Policy and Leadership there, and she is our local hero this March 15th, 2024. Thank you for everything you do, Rebecca.
Thank you, Congressman.